All right, I'm going to share my screen. We are going to be doing chapter 5 notes, part 5, and that is going to entail homeostatic imbalances of the skeletal system. So there are some different types of injuries, diseases, ongoing things that can happen to our skeletal system. We're going to talk about some acute things, which means they happen kind of sporadically, and usually they are fixable or treatable. And then we're going to talk about some chronic ailments, which is usually you can't cure it. It's a long, ongoing disease or disability, but you can manage symptoms. So some different acute injuries we could have could be something called a bursitis. So that's water on the knee. And so basically that synovial membrane that's going to be around the knee, helping to lubricate and keep that joint moving is going to become inflamed, and excess fluid is going to go there, actually decreasing mobility. A sprain is basically anytime you have stretching or tearing of a ligament, and a ligament is going to connect bone to bone, or a tendon, which is going to connect muscle to bone. And the problem with having a sprain is that it's this connective tissue that makes up tendons and ligaments. That cartilage is very poorly vascularized, so it has a really poor blood supply, so it's going to heal very slowly, and it's going to be a rather painful process for people. This is showing a picture of a bursitis, so some inflammation of the synovial membrane around the kneecap. This person has, laterally rotated their ankle out, and thus these ligaments can be stretched or torn. And again, it takes a very long time for people to heal. They might not even be able to fully recover. They might end up having to have some sort of surgical repair or replacement of those tendons and ligaments. All right, arthritis. Arthritis is probably the most common disorder when it comes to the skeletal system. And so arth, we know, means joint. Itis means inflammation. So joint inflammation. Okay. There are tons of different types of degenerative joint disease or arthritis. And there's two main categories, either acute, which is often caused by most likely a bacterial or a viral infection that we can give. In the case of bacterial, we can give antibiotics and hopefully that's going to cure. Or chronic is something that probably, or definitely somebody's going to be dealing with ongoing. They're not going to be able to cure it. The damage is usually, it's you can't reverse it, but you're going to have to just manage symptoms. All right, so acute joint disease, again, sudden, rapid, usually kind of extreme onset, most often caused by a bacterial infection. You can use antibiotics to treat this. An example would be Lyme's disease. So you get bit by a tick. The tick has this specific bacteria in it. It's like Burgdorfy something something. It's on the next slide. I can't remember what it is, but that gets input into the person or animal, whatever that gets bit. That bacteria is going to go to the joints and end up causing this acute joint disease. Person gets treated with antibiotics, and hopefully that all gets resolved. Here we go. Borrelia burgdorferi. Obviously, that's what it is. So the tick is the carrier of this bacteria. It bites the human and then causes this acute joint infection. Person recognizes the issue, gets treated with antibiotics, and it resolves. So that was our example of acute or rapid onset but treatable type of joint disease. We're going to talk about three main types of chronic joint disease. So again, this is something that somebody's going to have most likely, for the rest of their life. They're just going to have to manage their symptoms, and oftentimes there are periods of flare-up and remission. And the three most common are osteoarthritis or OA, rheumatoid arthritis or RA, and gouty arthritis. So osteoarthritis is the most common kind of just wear and tear of the joints. I think it's like 85% of the population is going to experience probably osteoarthritis at some point. And so what happens is that the synovial membranes around our freely movable joints, and it's most often in our fingers, shoulders, hips, and knees, they are going to the synovial membrane thickens, they stop producing the fluid that they should, and so mobility decreases, and the cartilage starts to break down. And the cartilage starts to break down, and then we end up not having cartilage there. And instead of having that articular cartilage smoothly moving against it, we have bone on bone, and that causes bony spurs to develop. And there's like cartilage fragments and maybe bone fragments, and that can cause this kind of crunching or crepitus sound. The damage is irreversible. It's usually not crippling. Usually people have kind of pain on the onset of exercise, but then once they get going, and those joints kind of loosen up and get warmed up, the pain decreases. It is treatable with, anti-inflammatory medication. Actually being active can keep the joints mobile, but you need to rest during painful periods as well. So this is showing a normal joint. So this would be the articular cartilage. This is showing the articular cartilage breaking down. And again, you've got fragments of cartilage, bone spurs that can be created because bone is touching on bone, and that's causing uneven bone growth to occur. And that's what causes that crepitus or kind of crunching sound. So this is showing some osteoarthritis here in the fingers. So these are the distal phalanx of the fingers here. And this joint surface, again, this was pulled up on image. I can see a little bit of fusion right here, a little bit of fusion right here. And so improper joint cavities. You don't see the nice fluid space here, I guess, as you would see here. In the fingers, that's where you can have the bone on bone fused together. And I'm pretty sure I probably mentioned this in class, or I will. That's called ankylosing, where you can no longer then move the joints. All right, rheumatoid arthritis. So rheumatoid arthritis is a chronic form of arthritis that is an autoimmune disorder. It is going to usually appear in women between 40 to 50 years of age. It's 3 times more likely in women than it is in men. It's an autoimmune disorder. So our white blood cells basically attach and attack our own joint tissues. Okay. They don't really know what spurs it or what, causes it to happen. They think it might be linked to some sort of infection, could be linked to a stress response, but basically our own body tissues or our cells or white blood cells are going to break down the cartilage in between our joints. So kind of a key characteristic to rheumatoid arthritis is that it is bilateral. So if there's pain in the right wrist, there's going to be pain in the left wrist. It's going to be bilateral on both sides. And typically there's going to be flare-ups and remission and flare-ups and remission. In regards to treatment for rheumatoid arthritis, they're going to give people immunosuppressants typically. And a very extreme thing, they would actually replace joints. So this is showing some ankylosing, where the joints are totally fused together because the articular cartilage has been broken down so much. This is showing the inflamed synovial membrane in the kneecap. Okay, and the last type of chronic arthritis is gouty arthritis. You may have heard of gout before. So basically what happens is that uric acid, which is a nitrogenous waste, which is a byproduct of breaking down, where we have 4 organic molecules in the body. We have carbs, we have lipids, we have proteins, and we have nucleic acids. Nucleic acids have a high amount of uric acid in them. For some reason, the uric acid gets accumulated in blood. It ends up falling out of solution, and where it tends to accumulate is in the joint of the big toe. So you've got 2 phalanges in your big toe. That is where this uric acid falls out of solution and it actually crystallizes. And it is very, very painful. It's like having shards of glass in that joint. It's very, very painful for people. So again, here we have this joint here. So this would be your metatarsal. So that would be between your metatarsal and your proximal phalanx here. This would be uric acid again, falling out of solution in the big toe and crystallizing. And again, my understanding is that it feels like somebody's got shards of glass inside their foot. There's medication treatment, there's diet, avoiding eating high protein, high nucleic acid foods, and not drinking. And the last type of chronic kind of illness for the skeletal system we're going to talk about is osteoporosis. And that literally means porous or holy bones, not like holy bones, but HOLEY bones. Okay. Um, so basically what happens is that bone loses matrix. So we lose spongy bone, we lose compact bone, which causes bone to lose their strength and rigidity. Okay. Um, this tends to happen to older people. This tends to happen definitely to postmenopausal women. So women who have gone through menopause lose their estrogen, which estrogen helps them maintain their healthy bone mass. And so bones just become weaker and more brittle, and they become more susceptible to fractures or damage. So this is showing, and for specifically for women, where you see issues are fractures in the spine or, compression fractures of the cervical vertebrae, the lumbar vertebrae, and of the neck here of the femur. So this is normal bone matrix, and then here's osteoporosis. So you've lost density in those bones. And you might have heard of people having bone density scans. Definitely elderly people are going to have this checked. Again, normal bone matrix, osteoporotic bone matrix. It is really important for people to stress their bones out to help maintain their bone density, eating a diet that is rich in calcium and vitamin D. You need the vitamin D so that you can absorb the calcium so that you can maintain your bone matrix. And really what happens is that as we age, our osteoblasts, so osteoblasts be bone builder, they become a little sluggish and they're not as good as replacing or replenishing our bone matrix. Activity is good. Right. And that is it.